Welcome back to Conversations with Boston School Psychologists, building safe and supportive schools one conversation at a time, where we spotlight the people, practices, and partnerships behind behavioral health and school psychologists in Boston Public Schools. Welcome back, Dr. Andria Amador, our Senior Director. We, of course, had her for episode 1. Please feel free to listen to that one first, as we'll kind of be expanding on that episode. But today, we're going to be talking a little bit more about what it looks like to be a school psychologist inside Boston Public Schools and the roles and the different types of comprehensive services that they're providing. So let's get into the first question. Can you tell us a little bit about the Boston School Psychology Department?
Yeah. So the Behavioral Health Service Department is the name of the school psych department in BPS. And we serve 121 schools. We have 105 school psychologists and on average 50 university students. And that ranges from specialist level, pre-prac, prac, and intern students, as well as we have a doctoral training program. We're super proud of training doctoral students. So we have doctoral level internships and some doctoral prac students as well.
Very nice. So thank you for giving that overview. And can you tell us a little bit more about the roles of school psychologists in Boston Public Schools?
Yeah, it's a question we get asked a lot when people find out about our adoption of the NASP Practice Model, and they want to know more about the roles and how people operate. So in general, we have 3 types of roles of school psychs. We have a school psych who is full-time in a school building, who is doing the NASP Practice Model every day. Then we have school psychs who are full-time, but they are split between 2 school communities, and they too are doing the full practice model, but in 2 school communities. And then we have school psychologists who are in a specialty role, and they're doing mainly assessments only for special populations. It could be bilingual students spread across the district. It could be students who are in private placements, in early intervention settings, who need an assessment, and then we're helping them. So those are the 3 types of roles.
Very good. And so can you share the specific examples of activities that your school psychologists do in their expanded roles?
Yeah, so it's really important to note is the impact that the FTE and the size of the school has on a school psych's role. So in Boston, we have many schools that are very small, less than 300 kids. And then we have some schools that are very big. Our biggest has over 2,200 kids. And so even if you're full-time in a school with 500 kids, very different than full-time in a school with 2,000 kids. So I just wanted to note that because people listening to the podcast may come from communities that are really small or have very big schools. So we recognize that difference. But in general, if you're a full-time school psychologist working in one school community, you're able to provide a range of services across those 3 tiers. So in Tier 1, school psychologists are leading universal screening. We use the BIMAS-2 as our universal behavioral health screening tool. The school psychs are helping to implement that. They train the teachers how to use it, how to review the data, and use the data to make decisions about kids. At Tier 1, they're also helping to implement culturally responsive PBIS, social emotional learning curriculum, and any climate initiatives the school has. At Tier 2, the school psychs are doing groups, social skills groups, targeted behavioral groups. They're doing consultation with teachers, setting up classroom management programs or behavioral supports for students at Tier 2, a lot of consultation. And then at Tier 3, that's where the more traditional services a lot of folks are familiar with. They're doing individual counseling, FBAs, behavior intervention plans, and then of course we still do assess.
Yes, and still do evaluations. Great. But it does seem like a much more comprehensive role rather than just solely doing evaluations.
Yeah, just noting that if you're a school psych who is split between 2 schools, you can't do all those things I listed in 2.5 days. So they are really working in close partnership with the social workers in their building to divide that behavioral health work and approach it together as a behavioral health team to say, how are we going to make sure we're meeting the needs of the kids in partnership with the social work role and the community mental health partners that are in our building.
Yeah, so when they do have 2 schools, it's generally smaller schools, would you say?
Right. We're very proud that we do meet the NASP recommended ratio of 1 school psychologist for every 432 students.
Amazing.
That's exciting at the district
Yeah,
level.
it's one of the best ratios I've ever heard of
Yeah.
nationally. I've just never heard of such a great ratio of school psychologists to students.
Yeah, that took a lot of years of advocacy, so stay tuned for future podcasts about how we were able to achieve that ratio, but that is our ratio at the district level. And so school psychologists in general, that is our ratio. And when you're in two buildings, you would, um, they're two smaller schools.
Have smaller schools. So you would still be able to do some of the more comprehensive, just not as much as if you were in one school.
Correct.
I understand. Great. So how does the practice of school psychologists vary across these different types of roles?
Yeah. So, as we're talking about the FT, I think it's a couple of things in play. We're all individuals, right? We firmly believe in the NASP practice model in our district, and we've adopted it and reflect it in the work of our school psychologist. But we know each one of us as individuals has interests and strengths. So, someone may be really passionate about culturally responsive PBIS. So, in their building, that's something they really lead. Other folks are very passionate about counseling, consultation, PD. And so while we give our school psychologists the training and the resources and the support they need to do all of these roles, really what each school psychologist does is kind of a reflection of what their school and their students need and then their passion and interest. Um, and we have a lot more work to do to even increase our ratio and make that ratio be at a building level. Because as I mentioned, our ratio is at a district level, which is great, and it does comply with the practice model. But we want to take that even further and make sure at every building it has that ratio. That's our goal, so that school psychologists can continue to provide those comprehensive services.
What advice would you give to other school districts where school psychologists are mainly just testing, mainly just evaluating students, and they want to have a more comprehensive role where they're counseling and they're providing different types of interventions? They're more hands on with the students. And so, advice would you give to other school districts in creating a more comprehensive role for themselves?
It's a great question that we get asked a lot. We have the privilege of presenting at places around the country, and people will say, I'm not even allowed to do that kind of work, or I don't have enough time to do that, or my boss doesn't define my role that way. And so, what I always suggest to people, and it's how we started, like we've been working on this for 15 years. So, it's taken a long time to get to this place of complying with the NASP practice model. But we started with one area, we focused on it, we achieved it, and we expanded and we expanded and we expanded. So my suggestion would be number one, start with something that you're really passionate about and your school needs. And again, for someone that might be counseling, that may be crisis support, it may be consultation, and make that your professional goal and expand your practice in that one way. And then next year, you add another skill or area and you continue to build it. And a lot of school psychs will talk about if you don't have a seat at the table, you bring a chair and you sit at the table. I think this is a way we can incrementally increase our role to provide the services that our kids need by each year adopting a new practice. The second way that we've done it is really put a lot of effort into communicating the NASP practice model, what the job description should be, and showing people how we can do it. And that helps people change their mindset about what the role is, how we can be used. And that gives people more permission to take on new things. But I think my third tip would be don't wait for your district to come to you and say, congratulations, we're adopting the practice model. It's not going to happen. Most school psychologists are not supervised by a school psychologist. It's going to take us advocating for ourselves to expand the role. So rather than waiting for permission or someone coming to you, be the one to advocate and go and stand up for yourself and adopt that new practice and show people how it can work. And I think it takes time, but you will be able to expand the role to meet the needs of kids.
Absolutely. And so one of the things that reminded me of was how with MTSS and building that out at a school, I've often been recommended not to just start with everything reading, math, and writing across the board with interventions, but start small. Start with something like reading, and then the next school year build to implementing math interventions. And the next thing you know, you have this really strong system of MTSS at your school. And so it's kind of the same thing with what you're talking about, where when it comes to comprehensive roles of school psychologists, start small and gradually work up over time. What did you say again? This was a 15-year process that you've been working on? Since 2010 is when you took on that director role.
Yeah.
And so it takes time, but if you start small and keep consistently, gradually progressing each year, you're going to see amazing results by the end of it.
I'm going to share a story as we close, Tim, with you. We had a school psych who was beginning this work in her building, and to your point, they had nothing, so they weren't going to start with doing the full MTSS. They were starting with building a positive climate and some of those core components of culturally responsive PBIS. So the school psychologist, who is still learning this, turned to her university student. University students are such a great workforce for us, but they also have a lot of knowledge that they're training us. And her student helped work with the students and the staff to come up with the PBIS values and to come up with a song for the school to sing their values to music. And we're Boston proud. And this brilliant student set the school values to the song of Sweet Caroline. So go Red Sox. And that to this day, 15 years later, is still one of my favorite examples of taking really culturally responsive values and making them very meaningful. And if you want to see that video, it's on our website. And that student was Tim.
Was me. I was the one who created that school theme song, and we put it to music, and the kids just loved it. They all adopted it. It became their school theme song, and we even made a music video of it. So yeah, it was awesome. Yeah,
It's pretty awesome. So Tim shows how you can start the work in one place, get people excited about it, and expand and build on it.
For sure.
Yeah.
For sure.
Thank you for that.
Absolutely. Is there anything you want to add before we close? This was such an insightful episode. I really appreciate you talking about all these different topics, but I just want to make sure we didn't miss anything before we close.
I'll just say that we have benefited so much from talking to experts around the country and other districts who've been so gracious in sharing their tips and learning with us. And so we'd like to do the same and pay it forward. Yeah. So check out our website. We have tons of resources there. If you have questions, ask. We love to share it. But just get started. Like a lot of people say, how can you ever get to where you were? And we always tell people this has been long, hard, messy work for a long time, but everyone can start. And you're then one step closer.
Absolutely. Well, thank you so much for listening to Conversations with Boston School Psychologists. And thank you so much to Dr. Andria Amador for joining us. Please follow us on our socials and visit our website, bostonschoolpsychs.com, to learn more about our work. Join our next conversation to learn more about resources and tips for creating safe and supportive schools. Thank you.